Hi, I'm Dr. Stephen Olmos, and I would like to introduce you to the Shirazi Hybrid delivery system for combination treatment with positive pressure and an oral appliance to maintain an airway. So, the advantages to this technique are there's no straps on the head. The device in the mouth holds the unit in place. So, this is much more comfortable for the patient, especially patients that have headaches or wake with headaches, and the strap might be irritating that kind of situation. The ability to use the oral device to open the airway and combination of delivery means that the pressure titration can be lowered. We see very routinely that we're able to get the pressure down to 4 centimeters of water. So this is much more comfortable for the patient in combination with severe cases or central apnea situations, or patients that have apnea but grind their teeth and also have arthritis in the jaw or facial pain. So the combination therapy addresses all of those issues simultaneously and therefore makes it an ideal delivery system. This can also has a quick disconnect so that the unit can be used independently. Elastics can be placed to hold the jaws together so that we don't get blowout from the mouth. So this allows the person to be able to use this perhaps maybe over a weekend, camping, things like that, where bringing the CPAP might not be possible. And then, of course, for the rest of the time, that it can be attached in this way. A big advantage for people that have claustrophobia, that have full masks with these little nasal pillows and urethral strip to open the nasal valve, we're able to get really good seals and with a lower pressure, not have problems with leakage, air into the eyes or out the mouth. So if the patient had been using positive pressure prior to delivery of this type of device, then the CPAP would have to be titrated lower, and AutoPAP, not a problem, BiPAP, yes. So this device can be altered. When we scan the mouth and measure the relationship of the nostrils to the gap between the front two teeth, we need to know if it's in line or offset, because then the device is fitted to that. There are adjustment mechanisms here where if we undo this, we can slide the unit in this direction. These rotating pins allow us to rotate it in this dimension. And then by opening these little gaps here, these are like zip tie, so you separate it. That allows you to move and get a good seal. And when you have a good seal, then you can crimp this down and that holds it in place. So we'll demonstrate this technique. So this is the device itself. This is the quick disconnect here. This device itself is FDA cleared to treat OSA. And so these straps allow for positioning optimally. There are tongue lifters to manage the tongue. So this portion manages the jaw, whereas the tongue positioners lift it up and move it forward away from the throat. So this is type 12 nylon, so this is thermally activated. If we need to adjust this, we simply put it in hot water, either open it up if it's too tight or pinch it together if it's too loose, put it in cold water, and it sets them. So as we put this in the mouth, the warmth of the body kind of softens it a bit. So it's very comfortable and doesn't have any kind of mechanisms around the teeth. Other types of devices that have made of acrylics and this sort of thing, they have clasp or things that go in between the teeth, and they tend to separate the teeth. And that's a problem with eating because you get food between the teeth. So this has none of that, as you can see. Okay. And so the first thing we want to do is we try this in. If it's too tight, and we try them in individually, first the lower, first the upper. Then when we have them fitting comfortably, then we connect them and add them as one piece. So the dentist would fit and deliver this portion And then the sleep therapist would be the person who would be adjusting the CPAP titration at the DME. Okay, so then first we just pop that in, and that goes to place. And so you can see opening, you can see the tongue here in the front because that's the lifters pushing it forward, opening the airway. And now all we have to do is simply connect the device. So that's this portion here, okay? And
Do
patient can do it very easily. And so important to get a seal here. So these little portions come in different sizes, small, medium, large. Now sometimes depending on the aperture, you might need a small on one side and a large on the other, or any combination. But you need to make sure that it's sealed all the way around here. And so this portion here is set to be at a very close approximation, so you don't really have to make very many adjustments. But if you had a little leakage, then you would loosen up this little portion here on the side and then slide this up until you get the proper seal. And then once you have it, then you crimp it together and that holds it in place. If you need to move this away from the patient, then you would undo these little screws here, and it would slide in this direction or forward until you have the most comfortable fitting. These rotate on the side, so if you needed to, you could rotate it in this way as well. Okay, so once you have a good seal and everything looks to be in place, well, then you want to test that. So then you would just hook this up to your CPAP.
So,
Yeah. Okay.
Auto.
Okay. And so then, as I say, if we're have APAP, then it's automatically going to self-correct and give the proper amount of titration. If it's CPAP, that's going to have to be adjusted. And like I say, most times we're able to get down to the lowest setting around 4 centimeters of water. So you want to test this in a position where the person is sleeping. So there we go. So you can lean back. So you want to be able to, so we tested it upright and there was no leakage. Now you want to place them in the supine position so that you can duplicate the position of sleep and see if it changes anything. As you can hear, the machine's working perfectly. There's no loss of air. If you did have loss of air, it would sound like this. Okay, sorry about that. And now we're back to a good seal. So in this way, as you can see, everything is contained. We've got the jaw, we've got the tongue, and now we're delivering. The Breathe Right strip opens the nasal valve, so that helps to give a good entry point. So as we know, nasal obstruction is 50% of the resistance to airflow. Thank you.